पोज का होता है, पोज उतर के नीचे।
Good morning everybody. Today we will discuss about the parenteral routes of drug administration, which includes intravenous, intraperitoneal, intramuscular, subcutaneous, intradermal, intramedullary, intrathecal, intraarterial and intraarticular. We will further talk about the intravenous route of drug administration. Intravenous means directly into the veins. So basically, we are using the antecubital vein which is present in the cubital fossa. Example are glucose normal saline (GNS), dopamine and norepinephrine drips for the IV infusion.
अच्छा विनीत, तो इसकी एडवांटेजेस क्या होंगी?
इसके बहुत सारे एडवांटेजेस हैं. सबसे इम्पोर्टेंट जो एडवांटेज है that it has 100% bioavailability. It directly enters the systemic circulation bypassing the first pass degradation.
अच्छा विनीत, तो ये बायो अवेलेबिलिटी क्या होती है?
Let's suppose we have taken 100 mg of drug, so it doesn't metabolize, it doesn't degrade into the liver, and it enters the blood circulation 100 mg. So it means it has 100% bioavailability. Other advantages are it has quick onset of action. Lesser dose is required to achieve the desired plasma concentration. As well, a large volume of fluid can be infused at a uniform rate because we are giving it through the syringe.
विनीत, क्या ये रूट अनकोऑपरेटिव पेशेंट्स में हेल्पफुल होगा?
बिल्कुल हेल्पफुल है. We can even give these route in the unconscious and uncooperative patient and in the patient which are having diarrhea, vomiting and nausea.
तो इसकी डिसएडवांटेजेस क्या होंगी?
इसके डिसएडवांटेज है कि we need strict aseptic condition and the patient has to depend on somebody for giving the injection. He cannot take it himself. It is painful and risky as well because once the injection which is given, it cannot be recalled back, and we cannot even give the depot injection. Depot injection are actually the oily injection, and since we are giving the injection into the bloodstream and blood and oil cannot mix, so we can't give the depot injections. As well, around the site of injection, we can see three important major side effects. One is venous thrombosis, necrosis, and thrombophlebosis, means inflammation of veins.
अच्छा विनीत, तो इन्फेक्शन हो रहा है तो क्या आप मेरे जेंटामाइसिन का आईवी लगवा सकते हो?
बिल्कुल. जेंटामाइसिन का आईवी लगवाने के लिए डोकामिन की डोज होगी. सबसे पहले सिरिंज, एम्पूल, वायल, स्प्रिट और कॉटन. एम्पूल जो होता है वो हम 1 टाइम के लिए यूज करते हैं और जो वायल होता है वो मल्टीपल टाइम यूज कर सकते हैं. Procedure: first we will wash our hands and put on gloves. Then we will fill the syringe with ampule or vial. We will tap the syringe to remove the excess bubbles, to remove the air from the syringe. We will reassure the patient and explain the procedure to him because the patient must not move during the IV injection. We will uncover the patient's arm completely. We will apply tourniquet. We will ask the patient to make fist with thumb inward. Wait for the vein to swell. We will wait for the vein to swell. The veins which are between the fist and the tourniquet point, they will get swell because of the blood accumulation. The vein will get superficial and they can be easily seen so that we can apply the injection into. We will select the vein which is longitudinally running for some distance and is superficial. The vein should run longitudinally for some distance, because when we insert the needle into the vein, the needle has the capability to pierce the wall from both the sides. So if the vein is moving, the vein is turning round and round for even little distance, so it can be hazardous for the patient too. We will hold the patient's arm below the vein to be used. We will disinfect the skin with a spirit and cotton. While disinfection, we will apply the cotton into circular movement from inward to outward in an onion peel appearance. We will stabilize the vein by pulling skin taut and longitudinal direction of the vein. Now, for every route of drug administration, there is a particular angle. For IV, it is around 25 degrees. We will puncture the skin and move needle slightly into the vein, around 3 to 5 mm. Now we will aspirate. In aspiration, we will pull back the piston a little bit towards ourselves. If blood doesn't come, give it another try. Means blood doesn't come, air has come, means the needle has gone into either a tendon or a muscle or into another tissue, but not into a vein. So there is no benefit of applying the injection into another tissue. In that condition, we will pull out a needle and we will see for another vein or the same vein but at a different angle. If the blood appears, it means you have inserted the needle into a vein. So moving forward, we will loosen the tourniquet so that the injection can go into the arm forward. We will slowly inject the solution. We will withdraw needle swiftly, press sterile cotton wool on the opening. Clean up, dispose waste safely and wash your hands. It was all about the procedure of IV. Next, we will move upon the interperitoneal route of drug administration. Site is peritoneal space. Advantages: